السلام عليكم طلاب إن شاء الله اليوم عندنا EEG lab. Okay, we will have a few notes about what's the EEG as an instrument, what's the basic physiological principle of using this instrument, and we'll have few points about epilepsy and seizure. Okay, so what is electroencephalography? EEG is the short for it's the short word for the big word electroencephalography. Okay, so electroencephalography is an electrophysiological monitoring method. So when we say electroencephalography, it's aimed by Y, we are talking about a method. So this is a method that's used to record the electrical activity of the brain. Okay, we're going to detect the electrical activity of the brain. Now the brain, the neuronal cells of the brain connect to each other by electrical charge. Okay, so these electrical charges can be detected by using wires or surface electrodes put on the scalp, and these electrodes can detect the voltage differentiation or the voltage among the areas where the wires distributed. Okay, and then the device, okay, can amplify these signals, يقدر يكبرها and filter it ويفلترها حتى تطلع لنا بشكل brain waves on the instrument. فهذا the principle of EEG in short words. Okay, so the brain waves or the brain electrical activity or signals can be detected by using simple non-invasive surface electrodes or wires. We put it, it's a metal wire, okay, put on the scalp, distributed in a specific manner. And by this method, we can detect these signals, and these signals is very short signals and very small signals, so it can be amplified by the instrument اللي هو الجهاز مالتنا. يصير بيها amplification تكبر وبعدين يصير بيها filtering تفلتر وبعدين تظهر لنا بشكل waves على الجهاز مالتنا. فهذا ال principle of EEG. So EEG is typically non-invasive, okay. The electrodes placed just on the surface of the scalp, so it's non-invasive. ما عندنا فد intra or intrusion on the brain, okay. So it's non-invasive. Yes, we say that the principle or the method called electroencephalography. The procedure that we used it's called electroencephalogram. يعني الجهاز اللي نستخدمه or the instrument called electroencephalogram. Okay, so it's the procedure or the device that's used to detect the electrical activity of the brain, as we mentioned previously. Yes, this is, as you can see, this is the device that I already talked about. It consists of two parts. The first part represents the recording electrodes. As we can see, these are small metal disc or metal electrodes put on the scalp. We have a specific international system by which we can distribute and we can put these electrodes on the scalp. Okay, each of these electrodes we can put these electrodes on the scalp. Now each of these electrodes have its name, okay, and the name according to its location and have a number, okay. Usually the numbers distributed on the electrodes are in even and odd number. Every even number is for the right side and every odd number is for the left, okay. And we have multiple international system. The usual one called 10 to 20. We put these electrodes in a specific measurement. نحتاج قياسات معينة ونطلع منها percent. This is not for you, just for the information. Okay, you need to just understand the principle. Yes, so these are the electrodes. Okay, and this is the scalp. Of course, this is an imaginary image, okay. إنه نسوي imagination and this is put on the brain, but actually put on the outside, okay. And these electrodes then connected to مفروض إنه هذه electrode connected to this head box, as you can see here. Yes, this head box, okay. هذا المكان طلع منه هاي الوايرات وبعدين يتصل بالجهاز حتى يسوي هذا الجهاز مالتنا الامبليفيكيشن والفلترنج وتطلع بشكل brain waves اللي راح نشوفه on the screen. Now, what are the main uses for EEG when we need to use this instrument? Of course, we need to use it mainly to diagnose epilepsy. okay, and to know if the patient have seizure or not. And in the next slides, we'll know what's seizure and what's epilepsy. It's also helpful in diagnosing other disorders within the brain. For example, in brain tumor, in the area where the brain tumor is located, we could have specific abnormalities, specific abnormal brain neuronal discharges, and can give an idea about abnormality in that region. Okay. Also, in case of brain damage, in case of head trauma, it also can help us. In case of inflammation of the brain, what's called encephalitis. Also in stroke or ischemia or infarction within the brain, and also in certain sleep disorders. Of course, we have so many other uses for the EEG, but we will just have these few points. You can memorize it and know it because they are simple. Okay? Yes. EEG, it's used commonly because it's non-invasive. Okay? Simply it's non-invasive. ما راح يكون أي تداخل بالprocedure. It's just a superficial or surface recording procedure. It's simple, can be used by technicians to assess the doctor in put the electrodes, okay, and low cost, simply low cost. So these are the main advantages for EEG, why it's used, and it's also take no time. It takes just a short time to finish the procedure and then later on perform the analysis and readings. So we say that the brain waves or the brain activity detected as waves بعد ما يصير بيها الامبليفيكيشن والفلترنج داخل الديفايس راح تطلع على السكرين بشكل waves. شنو الويفز اللي راح نشوفها على السكرين؟ We have many brain waves and we have main 4 types we should have an idea about, okay? The waves are classified according to the frequency of waves. كم wave تظهر عندنا؟ Now, each of these okay waves, okay، يعني ال up and down slope الصاعدة والنزلة it's called wave. كل واحدة من هذول نسميها wave. هذه wave، هذه wave. So according to the number of waves in a second we can know the type of waves. Okay, for example what's called beta wave لما يكون الفريكونسي مالتها frequency يعني number of waves in a second. So لما يكون الفريكونسي مالتها about 13 to 25 hertz. Hertz it's the unit used for frequency. So 13 to 25 means that we have 13 waves. Okay, up and down it's called one wave. So this is one wave, this is 2, this is 3, 4, 5, 6, 7, 8, and so on. So when it is 13 to 25 in a second, of course the paper of the device it's have a vertical lines. Each line it represents a second, so we can know how the second it's occur. Okay, but here it's not so clear. So in a second we should count the number of waves. If it is between 13 and 25 it's called beta. If it is less, between 8 and 13 it's called alpha. If it is more or less between 4 and 7 hertz it's called theta, and the lesser one it's between 1 to 3 and some books say 4, this is called delta. Okay, so it's named according to the number of waves in a second. Yes, of course each of these waves occur in a specific pattern and in specific situation, okay, so that we can know it's normal or abnormal. For example, beta waves, which is the highest frequency, can be seen during drowsiness. When the patient becomes drowsy before going to sleep راح يصير عندنا distribution of beta، تظهر عندنا البيتا. And also it can take place under the effect of some sedatives. Okay, when يكون البيشنت ياخذ sedative medication, it also can cause the appearance of beta among the screen. Alpha waves, this is the usual awake and relaxed state waves. Usually it's occur when the patient is relaxed, okay, and awake but close his eyes. It should be occur when the patient closes his eyes. Okay, so he's awake and relaxed, okay, without tension, and close his eyes حتى نشوف الألفا. Yes, what about theta? Theta اللي هي between 4 to 8, okay? It usually also take place in drowsiness as well as in the early stages of sleep. لما يكون patient from drowsy state to light sleep بعد مو كلش غافي يعني نسميها theta. أما الدلتا usually take place in deep sleep. لما يكون patient in deep sleep usually the main prominent or predominant waves راح تكون على السكرين هي الدلتا. Okay? Yes. So what is seizure and what is epilepsy? Epilepsy, it's a group of important neurological disorders. One of those disorders is the seizure, recurrent epileptic seizures, okay? So seizure is a symptom, but the main disease is called epilepsy, okay? So what is seizure? Seizure is the abnormal body movements which occur due to abnormal excessive neuronal activity. We say that the neuronal cells among the brain connect to each other by performing signals or by giving us signals, electrical signals, yeah? So when there is a problem within the brain and these signals are much more firing than usual and they are abnormally firing, this will cause a synchronous high discharge from the brain, cause what's called seizure. And this abnormal neuronal discharges or charge could be focal or generalized. That's to say, it could affect only a small area of the brain or could affect the whole brain. كل البرين يصير بيه abnormal neuronal charges, okay? Yeah, we have many types of seizures. You should know the names of these types, okay? We have what's called generalized, as we say, the whole brain being fired abnormally, unusually. This is called generalized tonic-clonic, okay, because the movement of the limbs will be in tonic state, tonic just a contraction, clonic contraction and relaxation. We have what's called absence, اللي يسموها بالعامية الصفنة. We have focal, as we said, only small area, so the patient will have focal abnormalities in his body. And myoclonic اللي هي نسميها بالجرك, okay, or فزة يسموها الفزة, okay. Just memorize the names, okay.